message to any women out there will be, if you feel anything different from your breast, go see a doctor. Because if you worry about it and you don't get it checked out, you still worry. So you may as well get it checked out and you can solve the problem.
Hai, saya Ira dari Lavender Medicare. Hari ini kita akan menginterview Dr. Jessie Hu dari Fem Surgery untuk membahas mengenai breast cancer. How do we detect breast cancer?
So breast cancer can be detected either by symptoms, that means patient present with say a lump or any changes in the breast such as nipple discharge, or it could be picked up asymptomatically on say screening mammogram.
So if we do ultrasound only, is it sufficient to detect breast cancer?
Unfortunately, no, because ultrasound look at masses. So by the time the tumor form a mass, is usually at least a stage 1 tumor. But for mammogram, we can pick up pre-cancerous stage. That means before they form a mass. And that appears as microcalcifications, which is like white specks on mammogram itself. That doesn't show up on ultrasound. So we do still need a mammogram.
Is it a lot of difference for the treatment between pre-cancer and cancer that has developed into stage 1 or 2?
Definitely there's a difference, because when we talk about pre-cancerous stage, the treatment is very simple, it's just surgery. But when we talk about cancer that's a bit more advanced, they may end up needing chemotherapy and other adjuvant therapy to reduce the chance of cancer recurrence.
So Dr. Jessie, how does the cancer actually form in our breasts?
So the main function of the breast, other than aesthetics, is to produce milk. So cancer develops from the milk producing cells in the breast, milk globules or the milk ducts.
So it appears in the ultrasound like different from the fibroadenoma and the cyst.
Yes, so the ultrasound is able to tell between a solid, which is a nodule, or fluid, which is like a cyst. A cyst is basically a water balloon. So it's a balloon filled with water instead of air. And between the solid lesions, we can tell how suspicious it is, whether it's nice and round or whether it's spiky like a durian or a Christmas tree. Those look worrisome.
Do we need to do a biopsy for cysts?
Generally, no, because most cysts are benign, but among cysts, there's a simple cyst, which is just like a balloon, or complex cyst where there's solid structures inside. So if it's a complex cyst, we do need to do a biopsy.
How do we do the biopsy for all these lumps?
Okay, so the type of biopsy really depends on what kind of lump. So if it's just a cyst, we can do what we call a needle aspiration to remove the fluid in the cyst. But for solid nodules, the two main options are either a core needle biopsy or a surgical excision biopsy. So in Singapore, we very much prefer to do a core needle biopsy first, where we take a few samples of the tissue. Or we have what we call vacuum-assisted biopsy, where we can take a bigger area of the tissue, and sometimes when it's a very, very small lump and it's not cancerous, we can even choose to remove the whole lesion during this vacuum-assisted biopsy.
How is the accuracy of the core biopsy?
Oh, the accuracy is more than 99.9%. Because we do it with ultrasound guidance, so we can actually visualize where the needle goes. It goes to the area that we're interested in.
So it's not necessary to remove the whole breast or a part of the breast to just do a biopsy?
No, it's actually not necessary. Also, if we worry about cancer, the kind of surgery we do for a cancerous lump and a benign lump is different. So it takes a bit of planning, and this core biopsy allows us to do the planning. Because if it's a benign lump, for example, this is a lump, we just go in and just remove the area of the lump. But if it's a cancerous lump, for example, such as this, I need to remove the normal tissue around it to ensure that all the cancer is removed.
So from there, you will decide whether the patient needs surgery first or chemotherapy first?
Yeah, so because 80% of breast cancer, we go for surgery first, but certain breast cancers, such as the triple negative and the HER2 positive, we actually prefer and encourage the patient to go for chemotherapy first. Yes, because we know that this tumor responds very well to chemo, such to the extent that sometimes it actually disappears.
So the steps are that you do a mammogram, ultrasound, then after that, if there's a lump, you will do a needle biopsy, core biopsy.
Yes.
And from there, you can decide what's the treatment plan for the patient.
Yes, definitely.
The cancer comes from the milk duct, right? We heard that if you breastfeed, you will not get cancer. Is it true?
Okay, so breastfeeding reduces your risk of cancer, but it doesn't make the risk zero.
But I also heard some mothers say that after she's breastfeeding, then she start feeling the lump.
And the difficulty these days is because we are having children later and later age, and we know that cancer risk increases as we age. So we can no longer say that a lady who's breastfeeding, the lump is benign. Because it's actually, I mean, in olden days when people have kids at 20, the chance of them having cancer is very low. So usually a lump during breastfeeding is completely breastfeeding related. Right now, when you're 40 and you're breastfeeding, I can't be sure.
That means the cancer is already there before she's even breastfeeding.
Probably. Yes.
What do you look for when you do self-examination on your breast?
Okay, so the aim of self-examination is to look for any changes in the breast itself. So we have the 12 signs that we should look for, and we say know your lemons, so you know the different changes such as lumps and skin changes in your breast, and also look for, you feel for any difference in consistency, any new lumps or hardening that develop in the breast. Cancer is, I put it as a stop sign. It's time to slow down, let's treat your health first, and then we get well and we get back to our life. So my aim as a doctor who treat with breast cancer patients is I like my patients to go back to the life that they were living before cancer. In fact, a lot of them go back to even a fuller life after cancer treatment, because they say, look, there are more things in life than work. So seek treatment early, get yourself checked, and don't be afraid.
Thank you so much.